Hi, everyone. This is Raji Amrish, the CEO and founder of the San Diego Pain Summit. And I am here with Dr. Justin Ternes. He is a doctor of physical therapy, and he specializes in chronic pain and has recently stepped in the role of creating and facilitating chronic pain groups for his local community, which is right here in San Diego, California, called Community Conversations on Chronic Pain. So welcome, Dr. Ternes, and thank you so much for joining us today.
Absolutely.
And so the reason I thought your project sounded really interesting because I think there's three levels to making a change in how pain is managed, and one of them, of course, is at the uh, really high corporate level. And then you have, educating clinicians, but then also educating the patients is helpful because as more and more patients realize what they can ask for adequate care and learning self-efficacy, the more they put the pressure on the healthcare system, the more likely that can change. And so I thought what you're doing with the community conversations on chronic pain might be something that other clinicians in the U.S. or who are listening might have an idea to do. And so I guess just to get started, how did you get started putting this together?
Yeah. Well, thanks for having me first and foremost. I'm excited to be on here and share whatever information I'm able to share with everyone who's able to listen. It started as an accident, which I think is a great way to start anything. I've done a few pain science education lectures just around my community, different yoga studios, my gym. I just felt the need and the desire to teach. I feel like I'm a natural teacher and I want to use that skill and master that skill. And I figured a good way to start is by just doing lectures here and there, free lectures, a few like paid lectures, but really just trying to get that experience under my belt. And so I thought, okay, I had a really successful pain science lecture just talking about essentially just what's going on in the biopsychosocial model primarily. And it was a Friday night and there was some good marketing and we had 27 people show up on a Friday night to learn.
Wow.
And I was like kind of taken aback by that, but it says a lot about the community too. I'm in Encinitas, so North County, San Diego, and just generally the level of interest in anything that comes to health and wellness is at a high level, and there's a lot of interested community members. And so my lecture was set for about an hour and a half. I assured everyone that it probably wouldn't take an hour and a half, and it didn't. It was about 45 minutes. And then I opened it up for Q&A. And during Q&A, like one hand went up, and then there was a question that took place, and I got to answer it. And then another question came, and before I could answer that question, someone in the audience, in the crowd, started answering it. And then people started just kind of pinballing back and forth. And I became not someone that was at the front of the room answering the questions, but more as like a facilitator, like, oh, hold that thought. What were you going to say? Okay. And I was kind of like directing the flow of the conversation. And I was like, oh, that's awesome. It was like pain science, but then the best, most important part, and like where like the most information came was during the Q&A session. I was like, okay, what if I do just a Q&A conversation? I was like, oh, I can call it community conversations for some alliteration there. But so I wanted to do another lecture like that. And I did one called Community Conversations on Chronic Pain, just to make it a little bit more specific. And the attendance was lower, it was about 15 people, but again, was able to facilitate. I did an intro on my understanding of pain, my theory, how I use that philosophy with patients, just to set the groundwork and the foundation work. And then I just went right into, I have a few questions. If people in the audience want to answer this and debate and communicate, then it'd be a great start. So that was another successful event. And then after that, so I think that's a great start. I feel like there are two different types of community conversations with chronic pains that I've created. One is for clinicians and acupuncturists and massage therapists and physical therapists, osteopaths that want to come and talk about their techniques. And that was in one situation. And then I had another chronic pain group that was marketed more towards individuals suffering from chronic pain. And so I thought there was going to be another like 20 people, 15 people, and only 7 people showed up. And so I was expecting to be in the front of the room and facilitate this conversation. And instead of having like me at the front, there were 7 people, and it was a small group. And so I was starting to go down the same lecture path that I had been doing in the other ones. And then someone raised their hand. They're like, can I sit on the ground? We're in a yoga studio. Like, can I sit on a bolster and be comfortable? And I was like, absolutely. Another hand was like, can I sit on the ground too? And I was like, yeah, does everyone just want to sit on the ground? And everyone's like, yeah. And so we got like bolsters out and like made it a nice, comfortable space. And then I just had the idea. I was like, let's just not do like me in the front. Let's make this a circle. So we did a little community circle. And so we turned that into not so much of like a structured Q&A, but more of a, hi, my name is blank. I have been suffering from chronic pain for X amount of time. This is my primary issue. This is how I feel. And then we went around the room, and that was something that also sparked a new idea for me on how valuable this work is for individuals suffering from chronic pain, because everyone has their own individual stories, but there's so many similarities: isolation, fear, practitioners that didn't listen to them, being thrown around the healthcare system without any success. So that really sparked my interest, and that's what I've been doing more frequently since that, is creating a chronic pain group for individuals that are suffering from chronic pain, so they can all connect and have a little bit of a understanding of each other. And I felt like the amount of the change in everyone's demeanor was really evident afterwards. And there was like a lot of people were just like breathing more easily and like smiling and being more open. And that triggered something in me. And I was like, okay, there's something good here. So I wanted to keep that going.
So that's interesting. So, and correct me if I'm wrong, but it sounds like, and I'm not going to touch on the pain group with the clinicians and other healthcare practitioners, but it sounds like the first one was where you were just going to educate them about pain. And then you noticed in the Q&A, there was more of this back and forth community. Mm-hmm. And then the second one, you just made it more all Q&A kind of. And then the third one was the one that you was more like everyone just sat on the floor and shared their stories. Is that how the progression
that
kind of went?
Yes, absolutely.
That's really interesting.
Yeah.
And did you notice, and you said you noticed a change after, on the third one, did you notice a change after each presentation, or was it the most change observant of people feeling relaxed was when they had more of a chance to share their story?
Well, I think, yeah, so there were changes in each scenario. I think after the first one, I know it's confusing. There was like the first one, second one, third one. But after the first
I gotcha.
one, we had the like Q&A going. It wasn't like a relaxed sense. It was like almost like everyone was like excited about like hearing it, and they're like, "Oh, this is great! I didn't even know that people practice like this, and I didn't know other people were talking about this kind of stuff. This is a really great lecture workshop." So there's a higher level of excitement and interaction and like community buzz. But on I would say the group circle, the chronic pain circle, the more intimate experience, individuals were able to talk more closely and deeply to their own personal experience. So it brought a level of empathy from everybody, and being able to be heard and have someone listen to you and understand and say, I hear you. Oh, I feel the same thing. It's okay. That brought about a level of like calm, and that's the softness, the relaxed sensation that I was speaking to. So like the first one was like, oh, bit buzz energy. Okay, this is great. Like I like learning on Friday nights. This is awesome. Now let's go to the bar. And then the third one, the circle, was more like, oh, my tension kind of went down. I think talking was something that was able to help me not only understand my situation a little better, but it decreased my symptoms a little bit. It feels good to be able to share and open up, and that's what really sparked my the fuel in me to be like, okay, this is something that's beneficial, and this is something that I can repeat and do on a frequent like basis. So.
And what are the so a lot of problems we hear, well, we and you probably as well too, from clinicians is that there's this debate about when you do let a patient talk about their pain and you're listening, that you're delving into the realm of psychotherapy, which of course I don't agree with
Mm-hmm.
myself.
Yeah.
I think it's plenty within the scope of a clinician to at least listen to their patient. And
Mm-hmm.
so in this type of sessions, what kind of boundaries do you set from the beginning, just to prevent it from going beyond, whatever that scope, the scope is of a clinician as opposed to a psychotherapist?
Absolutely. First and foremost, it's not therapy. I am a licensed physical therapist, but the group is a space for individuals to talk to each other just like they talk to their friends and family members. I'm here to provide like facilitation and help ask questions, but I'm not here to diagnose or fix. There's no fixing. It's just helping people understand and discover themselves a little better. So it's not therapy, and it's important to clarify that, as well as creating like a safe space and boundary within the walls and the time frame that you're using. So and a few other things that's important to really address is it starts at this time and it ends at this time. So we're going from here to here, so everyone knows that it doesn't continue on outside of that group. I'm not going to give
Because they want to drag it on. With
exactly.
any group, it doesn't matter what you're talking about, pain, dogs, fish,
Yeah.
people want to drag that
Yeah.
stuff out.
Any group, clear cut. This is when we start. This is when we finish. We might finish a little bit before, maybe like 5 minutes after, but it's going to be a clean cut finish. And anything past that, if you want to talk to me and if you want to continue this conversation with me on a one-on-one basis, here's my business card. We can set up some one-on-one sessions and do physical therapy real physical therapy.
Mm-hmm.
And so it's turned out to be a good referral source for me as well. I've got to see, out of the group of 7 that I first worked with, I got to work with 3 of those individuals on a one-on-one basis. So that got to continue, but not in the group. The group was here and that was separate. So it's important to address and say, this is not therapy. Yes, I am a physical therapist, but I'm not acting as a physical therapist. I'm acting as a group facilitator. So.
And what was there any, I mean, it sounds like it went really well as far as, in the audience it goes. Was there any kind of, especially in the first one that you did where you were just there to educate, but then you let the Q&A take over? What was the most common theme as far as what may be considered maybe pushback to the information, or maybe something that, for example, the very common, are you telling me it's all in my head, type of thing? Did you hear any of that, or did you think of that beforehand and then just present it in a way that wasn't even asked?
Yeah, so I didn't get a lot of pushback. I think that it's important to say that each individual's experience of pain is their experience of pain. Like whatever you're feeling it, and I can't take that away from you. And I can only speak from um, research that I've seen, experience. Um, so I feel like if I'm going to make a statement and say that you have a painful stimulus, external stimulus, like a pinch to your shoulder, um, the the neural pathway to the brain, the danger alarm system goes off, and your brain gets to understand and register what exactly was that um, external stimulus, what caused the pain. Yes, that processing did happen in the brain, and yes, there's associations, but I try to like I try to cushion that because that is a sensitive topic, and I'd have to go back and watch what I was saying and how I delivered it, but there was very little pushback. And I'm from the belief that yes, there's mind and body, but they're not separate. And my body is just as much of my brain as my brain is my brain. And so if I pinch my arm, that's me pinching an extension of my brain. So
Mm.
if I'm going to state pain is in the brain is the whole body, then this is pain in the brain and this is pain in the brain. So I kind of preface to that too, and I know that there's some pushback, but I didn't receive any pushback during my talk.
Yeah, I like that. The brain is in the body and the body is in the brain. So you said you'd have to go back and watch. Did you videotape
I didn't
yourself?
videotape that one. I videotaped my next one,
Mm-hmm.
um, which was more of the Q&A. And so um, that one I didn't watch either. I videotaped it, but I didn't watch it. And I'm like, I'm starting to this is something I have picked up from like psychotherapy. I have some friends that are psychologists, and I've done some supervision with the local psychology group just to kind of pick up on some of their connection with patients and cueing. And I think it's standard of practice in psychotherapy that a psychologist will record their patient and record themselves during a
Mm.
session so they can do some um, self-inquiry and see how they can improve and what they said and pick up on some changes in the patient. So I've started to practice that myself um, and record some of my sessions. And so I've been doing I've been going back and reviewing and taking notes on how I present my speech and how I present different analogies. But to answer your question, I haven't gone back and looked at the the
Oh, no,
workshop.
that's okay. I think that's an interesting thing to bring up because often from our perspective, when we're in the moment and we're doing something, we
Mm-hmm.
can easily feel like we're doing something differently than we are. So like, for example, when I was a massage therapist, I would have a friend come on, lay on my table, and I would video myself working on them. And that's how I could tell, like, if I was doing anything that where I might cause injury to myself or whatever. So that's actually sounds like a really good idea.
Absolutely. And so to back up a little bit on what I've been learning and practicing in my own rights, well, there's a form of psychology called um, ISTDP, so intensive short-term dynamic psychotherapy. It's an advanced psychotherapeutic technique, um, but that's what I picked up a lot of the cueing and the video feedback, and I sit with a group of psychologists on a weekly basis to observe their interactions with patients, and I'm impressed on one their level of like compassion and empathy with patients, and then also their ability to direct the flow of thought. And also, they all have a big notepad with notes on like 3 pages, and they're like, okay, at 17 minutes and 30 seconds, I said this. Can people help me with this? So I think that's something that's definitely important. And it's good to hear that you were doing that too with your own massage therapy. And I think that that's something that's lacking in not only the physical therapy profession, but a lot of other healthcare professions is being able to self-evaluate and record yourself. And it's simple to do as long as you present a video um, consent form and make sure that the patient is on board. And as soon as they're on board, you just emphasize this isn't for this is for my own teaching and my own learning of my practice, and it can enhance my therapy with you, so it's a positive for you too. But I think that's something that can potentially become more standard of care, and that should be more used and more readily used. So
Yeah, and I think it sounds like it might be a good idea if somebody's planning on maybe bringing pain education to their community. It sounds like it might actually be a good idea for them to attend psychology meetups, because it seems like you've already been attending those groups and you've kind of gotten an idea of how to facilitate and how, moderate and that sort of thing. And it sounds like you've done a really good job to progress from being on stage and just kind of barking out, telling everybody what pain education is. And now in such a short time, it's developed into this more of a community event. And so if for those clinicians who are listening, who are thinking about doing this, how would they go about to find maybe a psychology group that they can go and at least learn, again, not psychology, but just learn how to facilitate discussion in a group?
awesome. Yeah, I love this conversation. And before we started talking, you're like, make sure, are there any things that like you want to bring up that are really important? And I said they'll probably just come up naturally. This is one of those things. So absolutely imperative that you get some sort of an exposure to group therapy or group not group therapy but group discussions. And it can be a psychology group, it can be a local AA meeting, it can be any sort of like maybe another physical therapy low back pain lecture or something. But you want to get out into the community, put yourself in the seat of those that are receiving the
So it doesn't matter what it is, just any kind of like group focus, whether
yeah.
it be on addiction, whether it be
Mhm.
on pain or whatever, where you're in the seat as a participant and then observing how that group is moderated.
Absolutely. And I'm only speaking from my own experience, but I found that to be so beneficial because um, I can go in and just start and do a lecture without any experience or exposure, and I get anxiety thinking about trying to do that because if you don't have the tools, it's hard to get going. And I like to, again, with patients that are trying to learn new skills, I'm like, I'm going to give you a sword and you're going to go fight this dragon. But if you don't know how to use that sword, good luck fighting the dragon. Like, right? You have to practice and see and observe, and you watch your teacher use it, and you get stronger, and then you're ready to go and tackle that
And
opportunity.
if you only know the dragon's weak point, you have to know
And if
that
you
too.
only know absolutely, you gotta find that little opening in this hard armor. But yeah, so for me, in my experience, I went to a lot of there's a yoga studio, a local yoga studio that had like yoga and meditation and like your brain on meditation, um, different like pain and yoga lectures that like randomly throughout the week, and I would just go and attend those and listen to and see some facilitators really owning the room, others just kind of rambling and talking, and you can see how everyone's disinterested in the crowd, and you pick up on things, and just by observing you're like, okay, I've noticed that they didn't start by saying, hi, my name is Dr. Justin Ternes, I'm a physical therapist. They told a story and got people engaged, asked questions. And so I thought it was very beneficial for me to observe and see everyone do this in different ways. And I didn't take notes, handwritten notes. I just absorbed in like a sponge, took these mental notes. And then another really big positive for me that helped me know how to navigate that third and final group where there was only 7 people, and instead of just being like, okay, I only know one thing, which is teaching from the top, I don't know how to sit down and do a circle. I joined a men's group, a weekly men's group talking about emotional intelligence and emotional health about 8 months ago, and I learned a ton about how to just sit in a small circle, check in, how do I feel emotionally, and then how to be present for other people, how to listen, and if someone else is jumping in and trying to fix that other person's problem, then you can just say, hey, hold on, like hold that thought. We're not jumping in and fixing anyone. This is a time to like listen. Notice that the person that's supposed to be talking is listening more than everyone else. That's wrong. We got to switch that and like set ground rules. So my experience in the men's group circle helped me at the point where my group lecture turned into a group of 7 people. And then I was like, oh, I've been in this small group circle. It's a great way to connect. Is everyone open to sitting down on the ground in a circle? Yeah, absolutely. And so from there, I was like, oh, I can use that experience over there.
Mm-hmm.
And so that gives me confidence. I set up a workshop, and say I moved to Minneapolis. Like I'm new to the area. I don't know what's going to walk through the door. I say, hey, let's do a community conversation on chronic pain, and 7 people show up. I'm going to be like, okay, I know how to operate like a group of 7 people because I have experience working with small groups. Say I have the exact same lecture and 22 people show up, but I've only been working with small groups. I don't know how to handle that many people. Okay, no, I've been into big groups. I've been in small groups. 20 people show up. I can navigate that too. Okay, I need to go from this stance. And so I think and maybe you can tell how important I think it is by like how energized and how loud and vocal I got. But put yourself in the position of receiving the group education so you can learn yourself and better facilitate whatever walks through the door and whatever shows up to your lecture and group.
Yeah, that's a really great perspective. I also understand. I've also been in group therapy type situations and group discussions and like programs that were kind of run that way that were bigger. And it really is a difference between you're having a smaller group and a larger group. And the fact that you've brought that up is a really good point. So say somebody's listening and they're thinking, oh, this sounds like something that I would like to do, in my community. When you talk about marketing the event, what avenues did you use?
Yeah. Okay. So that's a tough one. That marketing that's a different dragon.
Or not even marketing. Actually, I should change that language because you're not selling anything. You're not trying to get your business out there. But as far as like bringing the attention to the community, in what ways did you put it out there that, hey, this is what's going on in case you're interested?
Got it. Yeah, and it's not particularly marketing because it's not specific, but it's promotion and how do you pull in an audience. And that's also difficult because I think you can use social media, you can print flyers, you can make your way around different neighborhoods. I think what was most effective for me is, and it's always been the case, even whenever I'm trying to market for my own physical therapy business, is face-to-face contact. If I'm going to message a group, I have MailChimp, and I'm not trying to reach a very large audience, like less than 100 people. So I think that tool is better equipped for people trying to reach a larger group. But for me, I take extra time to message people individually and add with start with, if I'm going to message and not be face to face, but reach out through text message, social media, email. I make sure to add that little personal bit directly to that person and let them know that I was thinking about them, not just thinking about 20 people and they're one of 20.
Yeah, and you
So
sent me one, I believe, through Facebook. I got a message from you saying, "Hey, how are you doing?" And a little bit more, and then, I'm putting together this community event, so that I could share that with people I knew who might be in San Diego.
absolutely, right? And connecting with people who are like-minded is so important, because you weren't able to make it, but you were able to put the message out there for others. And people who don't know me and aren't sure if I'm a trustworthy source of information, they
Hmm.
trust you, and they say, well, if Rajam knows Justin and trusts him, then I trust him. So I think that's important. And you have to do the foundation work. You have to do the groundwork. Um, Again, if I move to Minneapolis, I'll use that example again, and I don't know anybody, and I just start like bulldozing. Like, whenever you interact with people, they put up walls. There's like, I don't know who you are. Okay, let's see. And if I just bulldoze them over and be like, come to see this, then that's not the right approach. So you have to really take time and have patience and connect with people to make everything effective. And I think my the chronic pain group that only 7 people showed up, my time and effort to like put it out there was less, and there was less, like a smaller crowd that showed up too. And so there's a correlation for sure.
So have you done any of the, community sections in papers, or, cities have websites that do community sections. Have you tried that at all, or
Not
that's
not
just
at
not
this
your
Yeah,
thing?
not at this stage of the game yet. I've just kind of been like, oh, I have an idea, let me just go for it. Lone wolf. uh,
You want to keep it small, it sounds like.
yeah, I want to keep it small, but now that I've had a few successful, so I had the one small group, um, community conversation on chronic pain small group, now successful, and multiple individuals from that were like, hey, let's do this again. I was like, let's do it again, let's do it every month. So that's currently a monthly group, and it's maintained that core 7 group of people. It was 7, and then one person didn't show up for the next 2, so it was like 766, which I think is a good amount of people. But I'm excited by the thought of making this like a more accessible opportunity for patients to get exposure, and have some kind of improvement. So I'm starting to realize that my strategy of being a lone wolf and just texting people and saying, hey, what's up? And like maybe putting up small flyers in coffee shops is being outgrown by the the vision that I want to create from this. So
And just to go back to, when we're talking about boundaries and all that, do you have confidentiality forms that you have them sign, or anything that explains, this isn't physical therapy and all that kind
mhm.
of information?
Yes, yeah. So I have a welcome sheet, confidential a confidentiality form, and a consent form, just saying that they're open to, or it's like a privacy form, um, and their signature and email information. Optional to share their email, but I want their signature. So I do preface that and have them read over. There are a list of rules, like 1, this is not therapy. 2, the individual speaking is the speaker. We're not here to fix. This isn't. There will be no fixing, diagnosing, etc. So I have a list of rules, and um, just to plug that, I have a website where if you're interested, or if anyone's interested in learning more, you can reach out to me and I can help you I'm happy to help anybody like create this, because I think that this is a good start to something that can really impact people. And I think the idea of doing something on a national scale is good, but I'm in the train of thought that natural organic growth in the local
Mhm.
community is where like the most healing can happen. And
And
so
it's easier kind of, right?
mhm,
It's more effective, easier, less red tape. And your website, we will, if you'll send that to me and we'll put it on your bio page that goes
yeah,
along with
great.
this conference. But I just wanted to bring that in because I figured you did use a little form, but
Mhm,
for those who are listening, that is something that you would definitely need to think about. And then a final thought. So you have the people you contact to come. What about finding a space? So if somebody doesn't have a clinic that they can, or they know anyone who has a clinic, where are some places, like for example, I used to give free presentations and public libraries used to have community spaces,
mhm,
but what are some other ideas where someone who wants to do this might find a space that they don't have to pay for,
mhm.
hopefully?
Yeah, that's a big one, is finding, well, one, a place that is a safe space. You can have meetups out in like public parks and stuff, but that to be able to create like a space of safety and comfort, having random people walking by, I would consider as like a no-go. uh,
Hmm.
you want to have a place that you can ensure everyone in the room, hey, the doors are closed, windows are closed, no one can hear us, this is what, like, everything that happens in here stays in here, we're not going to speak about your story to anyone else, confidentiality. um, so a few places, I use a local yoga studio. It's one that I go to frequently to practice yoga.
Oh, that's a good idea.
Yeah. So there's a lot of local yoga studios that have gaps in their schedule that can, they'd be happy to plug it in. And I found it is very easy to contact, if it's a yoga studio, or if it's a like after hours PT clinic, if it's like a workspace, because those are popping up everywhere now, is like little community co-works. Um,
Hmm.
typically there will be some kind of charge. Maybe if you make 70, if you make X amount of dollars, we want 30% of profit just for our space.
Oh, so
Um,
these aren't free meetups?
so I've done, my first one was free, my second one was free, and then my third one, it was $10 to $20 sliding scale. It's just the kind of like a popular thing that is used in San Diego. Um,
And
so
sometimes people are more likely to show up if you,
yeah,
I think if they pay a certain amount or expected to pay a certain amount, it seems like, they'll show up.
yeah, yeah, because they see value to it, and they think, okay, well, there's some value. If I'm going to pay for it, then it must be good.
Hmm.
I like I like I like the idea of putting value on it by charging money. I don't want to charge too much, because I think that um, and with the chronic pain population, I think there can be a an ease to let things deter them from making that effort. And so if there's a X amount of money that's too expensive, that can be an easy excuse to not show up. And I don't want that. I'd rather have less money and more people than charge too much money and have very few people. So anywhere from free, I'm all about doing all the men's group. So I'm now facilitating men's groups too, not just sitting in one, but I facilitate that. All my men's groups are free, um, and so there's a balance, and I think that's up to whoever's running it. But there are a lot of locations that you present your what you're doing and why you're doing it and how it'll help the community, and then also say I can promote, and this brings people to your area, they can see how beautiful your space is. So it's like free advertising. A lot more spaces than I expected are like, absolutely, yeah, like And then you ask, well, how much is rent? How much? No, like, no, don't even worry about it. Yeah, this is great. You just do your thing.
Well, that's
Or
a good idea how you mentioned. I just want to break in real quick how you said you're letting the owner know, hey, this brings people into your space so they can see your space. That's kind of a way of saying, if you're looking for, because a lot of people are wondering what's in it for me, right? So that kind of, addresses that one.
yeah, and say a local yoga studio makes $60 off your talk because you made like 150 total or something, and they're like $60. I don't think $60 is going to be as valuable to them as having 6 new people who are like, oh my gosh, this place is really cool, and they tell their friends, and then they'll make a lot more money from just being open. So that's been a really good proposition to propose to the owners of different spaces.
Okay, so actually, it sounds like we're running towards the end of our time, and you've covered a lot of how I think that's very valuable for clinicians who are listening, how they can maybe get started with this group. But I like to end each of these uh, discussions I've been doing with a question, and that is, if somebody is interested in doing this, what is something they can do tomorrow to go ahead and take that first step? Um, maybe they've been thinking about it, they haven't been thinking about it. Maybe they have people who are interested, but they're not sure how to get started. What's like an actionable piece of information that they could go ahead and do?
Yeah, so step number one, given that they're already thinking about it, so that's step number one, is being like, I think I want to do this. So that actionable step um, is anytime that hesitation buzzer starts going off, like, ignore that. I would say,
The fear.
yeah,
The fear of action.
fear of action. It's just jump into it. Um, have faith. You want to do this for, like, that's what it's bringing you to think about even doing it in the first place. So there's that part of you that's excited about doing this. So actionable goal, I would say find 3 potential places that you would want to have the workshop. Pick a time that works for you. If it works for you, then it'll work for other people. Don't have paralysis by analysis, right? Pick a time, a day and a time that would work. Find 3 potential places that you align with and you feel like would be a good opportunity, and reach out to each of those 3 places.
Okay, cool. Well, Dr. Ternes, thank you so much for joining us and giving us this really valuable information. I know it's going to be of interest because I've heard a lot of people interested in doing something like this, and I really appreciate your time today.
Thank you so much. I appreciate it.